The Chief Executive Officer, Philips Africa, Jasper Westerink, speaks about the nation's healthcare and how his organization is partnering government to support the sector with DAYO OJERINDE. What is your impression of the nation's health sector? In Africa, there are hospitals which are fantastic and take good care of the needs of the people. On the other hand, the continent is still struggling to get really universal access to care at a level which is comparable to Europe and United States. I still see it as a long-term scenario where the government and the private sector together will increase the healthcare provision in Nigeria. Nigeria needs 450,000 additional hospital beds to be at par with other developing countries. It's a huge country, at least, the number of people is huge, and the other thing that I think is key is preventive education. If you realize that you have a large population of under 30, then preventive education and healthy living are important to contain diseases and virus like malaria and HIV among others. Lifestyle-related disease is also coming up, and half of Nigeria's population is below 30. If you don't educate them and support them on how to live a healthier life, then in 20 to 30 years from now, you will have a huge burden on the health system. How do you think the government and private sector can join forces to realize set goals in its health sector? If you look back 10 years ago, I think in Africa, typically you will see equipment sales, meaning you sell an ultrasound, which is great because the ultrasound is a fantastic product because you can use it for pregnancy test and a whole lot of others. However, I think we've now realized that just selling the ultrasound is maybe not the optimal way of doing business. You need to make sure that you train people, you need to make sure that you offer that care at the right moment, time, and not when it is an acute care. That is why I said the private sector and the government must step in. How would you compare increase in healthcare equipment sales in Nigeria with the result it gets? I want to clarify again on the equipment sales. What I wanted to say was that 10 years ago, we would sell an ultrasound and say this is your ultrasound, but now, both private and government have realized it is not just about equipment sales, you want to reach clinical outcome. Let us take again pregnancy. You can use an ultrasound to determine if this pregnancy is going well or there is a risk. Previously, there were sales of equipment, but now, we are much more talking to the government on what outcome they will like to achieve by deploying the equipment. If the outcome is reducing mortality rate, we know what you need is a scan. An ultrasound is a great instrument, which can support that, but it is not just about selling an ultrasound, it is looking at what you want as a clinical outcome. It is equally important to think of the human capacity building which you need to capture in a process. Yes, you need to have equipment and technology, but you have to train people. Even when they are trained, you need to make sure that there are protocols that will enable the same outcome for the same medical worries. What do you think about funding of the health sector in Nigeria compared to other developing countries based on the information available to you? You cannot expect every country to be best in every area, but if a significant amount of people and money are not moving towards the basic health facilities to the point that more people feel comfortable using them, I think it's a sign that the country needs to step up. If you have a country with many people, if you have an economy that is so large, then you need to find ways as a government to build true healthcare system. It is not sustainable for people to go out for medical tourism. You lose income, but moreover, you don't build local capabilities. Funding might be a challenge, but this instance goes the same way in solving Nigeria's problem, because we are open to discussing this with the Nigerian government. What is Philips doing to partner with Nigeria in healthcare? We basically have two businesses, the health tech solution business and personal health business. What we have taken up as a company is to positively impact on 3 billion people's lives by 2025 globally, and of course, Africa is the major focus. What we want to do is to help people make healthy and smart choices. For instance, we are creating awareness against constant consumption of deep-fried foods in Nigeria, while instead it could be air-fried, which allows just limited oil in them. What are your concerns about the country's challenges in cancer detection and treatment? Breast and prostate cancer are on the rise. Philips has made a choice in the past years to concern ourselves with mother-child mortality because of the high mortality rate. We are making huge progress, but we are not close to where we want to be, and we look forward to partnering with the government, and we want to be involved in the discussion about prostate cancer because not everyone has the right information. It's not just having a center but having a program with the government that has to do with the prevention, education and treatment specification. What programs do you have in terms of after-sales servicing of the technology you sell to the hospitals in Nigeria? I think we all realize that selling equipment is great but not enough, so what we are actually doing is organizing sessions where we invite all the relevant stakeholders to sit together for 3 to 4 days and look at the whole process. We invite private, public, NGOs and policymakers. It's great to open a treatment center, but we establish what the real need is. We don't just sell the machine, but we also sell the solution, which includes proper training for those that will be handling the machine. This solution generates good service that can last up to a period of 25 years, so you don't have to bother buying a product which may eventually not last. Nigeria has battled Ebola and last year witnessed snake bites in the north without vaccines to treat the victims. Is Philips partnering with the government to revive Nigeria's moribund vaccine-producing facility? Again, it starts with access and availability. In the case of snakebite, it means the facilities that people can go to should be readily available, and like I said earlier, our facilities enable proper storage of vaccines produced. What has been the government's response to the partnership you are trying to forge? We intend to intensely interact with the government. We believe that we have a set of globally experienced hands, and we believe we can bring technology and innovation that can help the Nigerian people. We have good analyzing tools that can revitalize the Nigerian health sector. Access to care and preventive education are key. Nigeria has a young population, which makes it important to educate the population properly, lest we breed another generation of unhealthy lifestyles, which in turn becomes a bigger problem. Copyright Punch. All rights reserved. This material, and other digital content on this website, may not be reproduced, published, broadcast, rewritten or redistributed in whole or in part without prior express written permission from Punch. Contact, email protected, visited 28 times, 1 visits today.